Thank you, everybody, for coming back in. It is my great pleasure now to invite Sonia Chesson up to speak to us today. So Sonia Chesson has worked with several folks in the room. She's the Deputy Assistant Secretary of SAMHSA, the Substance Abuse and Mental Health Services Administration. And among her many accomplishments, she was a key leader of the Kids Online Health and Safety Task Force, and has a real professional and personal interest in adolescent well-being, in suicide prevention, and in other relevant issues here today. She's going to be sharing her insights with us today, including some thoughts on what the SAMHSA organization might be looking for in this area going forward. And we're so happy to have you join us. Thank you for coming.
Good afternoon. So I'm a political appointee, so I don't know how much I can tell you about what SAMHSA is going to be looking for going forward, but I will talk a little bit about the work that we've done, and no matter what happens, SAMHSA will stay very true to its mission. And candidly, we have benefited from a very ongoing bipartisan support of the work that we do, so we are feeling very hopeful about the future of that work as well. And I'm really bummed that I was not here for the whole day. When I was looking at the agenda, I was really excited about the conversations that I know you have had, and all of the information that was shared or the questions that were asked. There's probably more that we don't know than what we do know, but we do know a lot, and we're learning more all the time. So just as context for those who don't know about SAMHSA, NIH colleagues here. SAMHSA is the Substance Abuse and Mental Health Services Administration. It is part of the Department of Health and Human Services, and we are the part of the Department of Health and Human Services that focuses entirely on promoting mental health, preventing substance misuse, providing treatment and supports for recovery. And we are particularly committed to children, child and youth mental health. It's something that I've been working on for most of my career, so I get to lead some of that work at SAMHSA. But at SAMHSA, it's really cross-agency, across our whole agency. In the last 3 years, we've spent $1.5 billion on children's mental health, but that doesn't include all of the work that we do on substance use prevention that is almost entirely targeted towards young people, and many of as I've spent the last 3 years making our mental health promotion and our substance use prevention, realize that so much of their work is very, very similar, and we have different folks who get the money, but at the end of the day, what we do to support young people's resilience and promote their mental health is very similar. So in 2022, the White House announced several key actions aimed at promoting the health and safety of children and youth who use online platforms. And among the sort of two big things that happened with that White House announcement, one was the announcement of a Center of Excellence in Social Media and Youth Mental Health, and that you guys have already benefited from all of the incredible things that we are learning, Megan, from the Center of Excellence, and they will continue to be a SAMHSA grantee and partner through the work. And the other piece of the work was the announcement of the Kids Online Health and Safety Task Force. We were asked to support the Center for Excellence, or launch the Center of Excellence, and we awarded the AAP $2 million to do that. So the Kids Online Health and Safety Task Force was really intended to be a cross-government effort because of the clear understanding that there are so many federal agencies involved in this work. And we're focused a lot on mental health and particularly on education, but as you know, in the area of safety, there are a lot of other players at the federal level. So while the task force named the Department of Health and Human Services, so SAMHSA, we had our colleagues from CDC, we have colleagues from ACF, from NIMH and NICHD. In addition to that, SAMHSA co-chaired this work with colleagues from the Department of Commerce, the Department of Education, the FTC, which is very unusual that a regulatory agency is involved in something like this, which is a federal program, we had FTC and very, very strong participation there, DOJ, DHS, and then the White House. And we brought together experts, policymakers, stakeholders, young people. We did multiple listening sessions. The Department of Commerce put out a request for information, which yielded almost 500 comments. We did literature review, so did a lot of work to try and understand how to inform this conversation. And from the beginning, we were always weighing the pros and cons, the benefits, the risks, and so on and so forth. But we did end up with a report that summarizes the risks and benefits of social media on health, safety, and the privacy of young people. As well as the best practices for parents and caregivers, which we worked very closely with our colleagues at the Center for Excellence. Practices and a toolkit for industry, which was a very significant contribution and probably led to moving some legislation, or at least some support for legislation, because at the end of the day, we can do a lot about media literacy. We can do a lot to offer tools for parents, but the industry needs to make some significant changes. There's only so much that we can do on this side of the equation. And then in relation to that, suggested actions for policymakers. But one piece of all of this was the research agenda. And so I'm gonna talk just a little bit about what it is we need to know more about. And I know that you've probably already talked about quite a bit of that this morning, so forgive me if I'm repeating this, or maybe I'm just validating it. How about that? So I asked somebody once, what if you're saying something somebody already just said? You're like, well, they hadn't heard it from you, so. So anyway, parents, caregivers, educators, policymakers have all expressed their concerns that technology has advanced without really clearly understanding what the effect is on young people's safety and privacy and health. And so we really are trying to prioritize with this research agenda places where there really are gaps in the existing literature. Not surprisingly, there are very few longitudinal studies. It's just too new, right? We have some very overarching objectives related to the research agenda, the need for continued study of the harms associated with online platform use, the development and evaluation of scalable interventions to protect children's online health, safety, and privacy, broadening access to data. This is probably the most significant thing that researchers are asking us for, the platform data and the algorithms. I will say that we learned probably as much from young people as we did from anyone else in this process, both very young people who could not necessarily completely articulate what was happening, but who knew this was like the doom scrolling wasn't making them, not doom scrolling, scrolling. I'm sorry, I'm bringing the doom in. But just the endless scrolling that they couldn't control, they have a sense of that doesn't feel right, all the way to young people who absolutely understand what all algorithms are, and what they want is transparency in algorithms so that they can do more to control their own use so that they understand better what's happening. So young people are a hugely important voice as we move forward. I know my young people who aren't even young people anymore, I'm perpetually having to ask every question about everything. So we have some kind of key essential questions that we're asking. What are the health benefits and risks of social media for youth populations in specific contexts? Which specific design features, and this is a lot of the work that we did as it related to what industry needed to do, is very focused on this issue of these design features, are potentially harmful and which ones are beneficial. There are ways to do things that make it better, right? Putting little awards in games that you lose when you turn off the game probably is not a great way to make sure that people turn off the game. So there are a lot of things that can be done that make a huge difference there. And how can protections and controls be tailored for parents? So there were quite a bit of areas of domains of interest in this research agenda. We highlight some very specific things. One is to look at this at different developmental stages. You guys have probably already talked about that. This matters a lot. Assessing long-term risks, again, determining the effectiveness of protections, and then studying the effect of technology in schools. So just, I'll just say a few things about this last issue of research priorities to help schools and community-based clinicians. The first is that the report makes recommendations for multidisciplinary research that focuses on a holistic view of youth well-being. And I think our education panel spoke to this. We know this across the board when we talk about child and youth mental health, that kids live in a variety of areas, and that the work that we do, any of the multi-systemic work that we do, always thinks about the fact that we need to be working with kids in schools, in communities, in families. We really need to make sure that we're looking at young people's mental health, regardless of in which area, in a multi-sectoral way. It should be included in broader health. Mental health is health, right? And it should really tap from a wide swath of fields. So brain development, psychology, physical health, education, computer science, social interaction, social determinants of health, societal influences. Like every single one of those things that we look at when we think about mental health, we need to be thinking about it at the intersection of social media. And then back to the sort of data-informed theories and conceptual models that really think about how digital and social media exposure and usage impact developmental trajectories. So we want to be thinking about this from infancy. I keep telling our colleagues at the Center of Excellence how I was so freaked out when I first started hearing how language development was being affected by parental phone use. That is sort of overwhelming to me, just to think that your kids aren't getting basic words because you don't repeat words back because your face is in your phone. That's like a big deal. So there we have questions of interest, which include how digital and social media exposure affect empathy and compassion, social and emotional competence, my laundry list, executive functioning, self-regulation, language development, early literacy and numeracy skills, there you go, attention and memory processes, motivation, identity, creativity, gross and fine motor skills, physical development, activity levels, sleep, weight status, all of it. Everything that you think about when you think about child development, you have to think about it in the context of social media. And finally, the effects of ubiquitous computer use in schools, and the whole issue of phones. When I first heard about this sort of banning phones, I was like, absolutely, categorically, ban them everywhere, actually outside of schools, everywhere. But it seems a little more complicated than that, and I'm coming to understand that we need to be nuanced about everything. So, schools are able to monitor children's online behavior, which is good, but also creates some privacy issues. And how do the schools kind of deal with those issues? What measures can be taken to ensure that students' privacy is protected while still fostering a safe online environment? So there are a million questions. I've just raised a million questions. Luckily, I got to talk about the research agenda, not the research findings. But there are some, and we hope that the more that we are able to be moving. We were recently in a panel at APHA where people were like, "Oh my God, it's too late. They're ahead of us. We can't even begin to catch up." Of course, we can catch up. I mean, we just need to say, okay, this is about learning. This is about awareness. If young people are coming and saying to us, like, we need to understand the algorithms, they've caught up. We just need to catch up with them, right? So we are going to continue. We're going to continue our partnership with the Center of Excellence. We will hope that the work that they're doing and the research that they're doing will inform so much of what young people and parents are doing in terms of their ability to monitor and do their family plans and so on. And we will continue to partner with other federal agencies around this topic. I will say that the Department of Justice, the FTC, the enforcement agencies are very, very concerned, and they're out there working hard. So hopefully, we'll see. I'm not going to say anything. I can do this. It's just that AG appointment. Okay, never mind. I'm going to be in so much trouble. So we won't tell, and I'm gone anyway, right? So we really, really hope that future studies can build on the research that we have seen so far. We want to make sure that community concerns, school concerns, and all of the science we can get really informs the best practices and policies how young people engage with media today may not even be how they engage a year from now. In fact, it won't be, right? And so addressing health, safety, and privacy concerns for youth must be an ongoing whole of society approach in which industry, parents, caregivers, schools, health providers, community organizations, and particularly young people are involved in thinking about this. So thank you for being here. Thank you for doing this work. I look forward to hearing more from the next panel. Thanks so much.
So this is actually the perfect introduction to our last panel. So I would like to invite all the folks that are going to be on our research panel to come up to the stage. So we just heard from Sonia Chesson some of the many questions and some of the many tasks that we have put to folks on the who are researchers in this area. And we are so fortunate to be joined today by 4 folks who have actually been doing research. We've talked a lot about how complex the issue of social media and children's mental health is, how challenging it is to study, and we have 4 people with us who have figured out how to do meaningful work in this space. I'm gonna briefly tell you their names. They're gonna say more about who they are and what they do. And one quick change to the agenda. Unfortunately, Claire Wardle was not able to join us. But we are going to be, we're gonna have this panel. Amanda Leonard is going to both speak and moderate. We are joined as well by Dr. Ashley Maxey-Moorman, by Mary Madden, and Dr. Jamie Sidani. And we are so looking forward to hearing from you both about what you have figured out and also what your questions are and what we can learn from your experience about what's gonna be needed going forward. So thank you so much.
Thank you. Thank you so much. I'm delighted to be here today. I'm Amanda Lenhart. I'm the head of research at Common Sense Media, and I will be your sort of panel jackalope for today, the hybrid moderator panelist, but mostly moderator. Thankfully, Claire Wardle, who wasn't able to be here, was a very well-prepared person. So we will be drawing heavily from Claire's preparation today, and we are just so lucky to be joined by some exceptional panelists. I'm gonna give a quick background for each of them, and then we'll dive into our questions. So on the end, we have Mary Madden, who's a senior researcher and strategy consultant with over 2 decades of experience leading national research studies that explore the impact of emerging technologies on culture and society. She is currently an adjunct professor in the Communications, Culture, and Technology program at Georgetown University, an affiliate of the Data and Society Research Institute in New York City. She's an expert on digital privacy and trends in youth media use. Prior to joining the faculty at Georgetown, she was a senior fellow at the Joan Gantz Cooney Center at the Sesame Workshop and directed an initiative at Data and Society exploring the effects of data-centric systems on Americans' health and well-being. And everybody is, it's amazing. Everybody's amazing. Next, we have Dr. Ashley Maxey-Moorman. She's a licensed clinical psychologist currently working in the HIV prevention and treatment program at Children's National Hospital here in Washington, D.C. She also holds a faculty appointment as an assistant professor of psychiatry and behavioral sciences and of pediatrics at the George Washington University School of Medicine and Health Sciences. In her research, Dr. Maxey-Moorman has examined discrimination in digital spaces, health outcomes, and protective mechanisms. She aims to better understand the health impact of online discrimination among youth with intersecting marginalized identities to create transformative pathways towards improved health outcomes. And finally, we have Dr. Jamie Sidani, an associate professor, at the University of Pittsburgh. Her research focuses on the intersection of media and health with a particular interest in investigating how we can use media and technology in ways that promote health. Her work has examined the association between social media use and mental health outcomes, the spread of misinformation on social media, and online marketing of emerging tobacco products. Much of this work uses novel methodologies, such as combining in-depth qualitative, quantitative, and social network data. As a part of her research, she aims to utilize community-based participatory methods, especially when working with adolescents and young adults. And so today, I think what we will be talking about is both what we know about the research today, how it informs or doesn't inform our policy conversations, and also talk about some of the innovative methodologies that almost everyone on this panel has been working on to try to find new ways to better understand what's really going on with young people and digital technologies today. So I'm gonna kick us off with a very favorite kind of question for researchers, which is to start with definitions. And I want to ask each of you to talk about some kind of, I think, a term or a definition thing that we need to define more clearly before we can move into this space. I'm going to take the moderator's prerogative and start, which is that I think we need to, as we launch into our conversation today about research, I think we need to separate out when we talk about mobile phones and social media, we need to remember that in some ways mobile phones are a vector for social media, but they aren't necessarily, they can be detached from social media. So making sure that when we talk about some of our concerns with those technologies, that we're thinking about, hey, is it really just the notifications that come from social media apps on a smartphone that are the problem, or is it something essential to the phone itself? So I want us to detach those two things as we talk today. And I'll kick it over to Jamie.
I just wanted to piggyback on that. Also thinking of social media, realizing that it's not a monolith, right? I think we've heard from a lot of the speakers today, a lot of the panels today, that there are so many different platforms, and how young people define social media is a little bit different than how older people define social media. Different platforms have different affordances and ways that we use them, so just kind of keeping in mind that as well.
Yeah, and I think I'll add to that. There's so many different screens that we have access to right now. So we have our TVs, we have our phones, we have our computers, and so there are different types of screens that we need to be considering with regard to impact, but also content is important to consider as well. And so obviously we've talked a lot today about positive content, negative content, neutral content that we're all exposed to, and so I think really being clear about what we're chatting about and being intentional about defining those things is important, especially with regard to research.
And I think I'll add something that I know I'm guilty of overgeneralizing about, which is referring to all youth, all children, all teens, right? We have to do that to a certain extent, especially when we're talking about generalizable findings. However, it's incredibly important for us to be thinking very specifically about different developmental stages. And when we're starting to think about interventions, obviously, I think those of us in this room understand that there's a radical difference between what might be developmentally appropriate for a second grader versus a sixth grader versus a 10th grader. But a lot of times we get these policy discussions, and particularly in the media, a lot of debates that sort of mush all kids together. And I think that's actually quite dangerous. And I think that the urgency around what we need to do for young children in particular gets kind of swept under the rug when we lump the needs of teens, middle school aged kids in with younger kids as well.
That's great, thank you all. So I think that's a really helpful setup as we dive more deeply into the meat of our conversation. So we're gonna go right straight for it. So when you reflect on the current debates that we're having that are playing out in the media about children and media, what do you think is missing? What do you wish that people knew was missing from this conversation?
Are we gonna go back this way?
We
now?
can go back this way, and people just jump in.
How much time do we have? No, so yes, there are many things missing from these conversations. I guess I would say, first and foremost, the voices of youth are very often missing from these conversations, and today's event was exceptional in that regard. So thank you to everyone at Brown and everyone who was involved in planning this event. The Young Voices group, you guys are awesome, and you need to go on tour around the country, around the world. I was asking them, are you part of a national network? Because I have two teen boys, one who is a 10th grader and one who is an 8th grader actually in Arlington County Public Schools. So I was looking forward to having a word with Francisco Duran. But in any event, no, Arlington's great. But, it is. It's great. But even in a school district like Arlington, where we have a lot of resources, we're also strained from post-pandemic times, right? And, every kid has, in high school, has access to an Apple laptop. but they might not necessarily, have access to the mental health supports that they need. And so I think there's sort of in the media conversations and debates about these issues, there's sort of this cognitive dissonance around, and I think young people pick up on this, around, this message that I need to know how to use technology. I'm required from kindergarten now in many places to, use an iPad or a Chromebook for all of my learning. But at the same time, I'm being told, this device that I use to connect with primarily my friends and my family, and that brings me, a mix of joy and challenges, but is like truly my lifeline to my social life, is bad, right? And so I think the conversations that we're having about changes in schools, I really hope we can see more youth voice in those conversations before we kind of close the curtains abruptly and then just say, let's see what happens. So great.
Yeah, I'll definitely second what Mary shared about the youth and their voice being really important and often left out in the media conversation. I also think that we've done really well today talking about nuance, but generally speaking, I think in the media, that's something that is often left out. And as a clinical psychologist, that's my favorite word to use. And also the phrase that I love to use is that when we're thinking about impact, it depends. It depends on what types of screens we're talking about, the content that they're looking at. It depends on who we're talking about with regard to what psychological disposition a kiddo has or a teen has or a young adult has. It depends on where they're at when they're using these devices, and it depends on who they're around. And so we know from emerging research that these are really important contextual factors to consider when thinking about impact. And we'll talk a little bit more about that today, I know. But these are just things I think that really help contextualize the conversation that are often left out.
Ditto. So I love being here today. I learned so much, and it was great to hear from everybody. And of course, as panels are going and people are talking, I'm like, oh, somebody should we should research that. Not me, but somebody should. But I started to think a lot about recommendations, right? As we're going to be kind of coming up with some of those, and a lot of people have kind of already proposed some things. Is feasibility and acceptability, right? Like, are these recommendations that can actually go into place, and like how can we look at that? Like, I hear a lot about the third space, right? So we saw the graph in the beginning of how young people are kind of being displaced, I guess, from having these like in-person conversations and meetups and things like that. I'm also a parent of a 15-year-old, a 13-year-old, and an 8-year-old. So, and I'm thinking, we tell young people that they should be off social media and they should be congregating together offline, but where can they do that if sports are being privatized and schools are being defunded and the arts are being defunded? And even my own teenager will say, I can't go to the mall because there are rules that you can't have kids there. I can't go to the amusement park because there are rules that you can't have kids there. I can't even go to Rite Aid because you can only have 2 kids in there at the time. She got kicked out of a playground because a mother told her that she was too old to be there. So where can these kids go in order to have those real world connections? Then if we take away the social media, not saying that that's what we're going to do, but if we limit that severely, where do they connect?
I love this. This is awesome. So I want to shift gears a little bit and sort of dig into some examples. I'd love to hear some examples from the panel about a study that you've read or that you did yourself or that you know about that you think is particularly well designed, that you think it does a really good job of trying to understand some of the problems that we're here discussing. It could be an old one, a new one, an American one, or US one, a global one, quantitative, qualitative. What can we learn from, tell us about a great piece of research we can learn from. And I can go last because I've got some too.
Okay, basically anything Amanda Lenhart has ever worked on, because she's not going to say that herself. But also, I would highly recommend the National Academy's report that came out earlier this year. It was a comprehensive consensus report, which I know sometimes with government reports or nonprofit reports, it can be hard to like place the relative importance of it. But this was like a very, very, thorough and well sort of researched report that I think does a really good job identifying what we know, what we don't know, and really does present that nuance that is needed in these conversations.
I'll add a mentor of mine, Dr. Brenda Shatine. She's at USC. She does really great research on digital literacy, which we've talked a lot about today. And to add to what you were saying about National Academy of Education, they also recently, I believe, came out with a report on civics, discourse, and education. And Dr. Tynes and a number of other folks doing research in this area wrote a chapter on digital citizenship that I think is probably a really helpful read for everyone in the room. We've chatted a lot about that today, specifically within the context of digital literacy, but also civility and safety online. And I think those are really important topics to learn more about. But a particular study that I'll mention is one that came out in Nature this year, actually. I believe the first author is Vaid, V-A-I-D, and colleagues. And I really like this study because they did a longitudinal study that looked at the within-person and between-person effects of social media sensitivity on well-being. And so what they found, and I believe the study was done with young adults, so may not necessarily apply to teens or younger kiddos, but a helpful start. And what they found was that the effects are variable. It just depends on the person. And so, for example, for someone who might have already been experiencing depression or loneliness or dissatisfaction with life, those folks tended to report more negative social media sensitivity in comparison to others that did not have those psychological dispositions. They also found that, generally speaking, more folks who spent more time online, I should say, reported more negative social media sensitivity. And also, those who tended to use social media when in social settings and when in nature tended to report more social media sensitivity or negative social media sensitivity. And so I think those are really important findings because it helps to highlight the context and that nuance that we've been talking about. But the methodology is also really important to think about because we need, as everyone has been saying here, more longitudinal research and also research that looks at the person and not just these larger groups of people and comparisons between groups. And so I think that's a really helpful study to refer to.
So not one study in particular, but I really enjoy the work by the Center for Digital Thriving at Harvard University. So, they do a lot of community engaged work. They talk to young people. Actually, two of the researchers there, Dr. Weinstein and Dr. James, they published a book called Behind Their Screens, which is an excellent book. I teach it in my undergraduate social media and health class. And basically, they followed for quite a long time, many years, talking to young people, right? So what is your experience online? What is the positive and what is the negative? And what are the solutions that you have? And one of my colleagues at Pitt, Sophia Chukas-Bradley, works with them as well. She does a lot of work with queer youth and how they experience social media, especially those with intersecting identities. So a lot of really neat work coming out with many great researchers.
Thank you. I want to talk about one piece of research that I did with actually somebody in this room, which I think highlights sort of two things that I think are really important going forward in this work. And it's a work that I did with Jenny Radesky in her lab at the University of Michigan. And it's a piece of work that uses this wonderful app that your team developed, Jenny, which allows for passive data collection. So it allows for instead of having people report what they're doing with their phones, it allows us to kind of pull information out of the phones. Now, there's a lot of challenges with that still, particularly involving Apple's privacy rules that can make it difficult to look across the full mobile phone ecosystem. But that kind of data collection, I think, can be a really helpful addition into this space and give us other kinds of data to work with. I also think a thing about that study that was also especially important is that it used participatory design. And we took the data after it was collected and we brought it to young people and we showed it to them and we said, what do you think? Does this resonate with you? How would you interpret this? And we learned incredible things by talking to young people about it. So it's both this mixed method of a data collection that is passive as well as this just qualitative research which involves young people deeply. So we learned things we saw in the data. My favorite piece, and probably know what I'm gonna say, Jenny, which is we saw that young people often listen to YouTube or are on YouTube all night long. And we're like, whoa, as adults, we look at this and we're like, they're watching movies all night, they're not sleeping. And then we asked young people and they're like, no, it's my white noise. I'm listening to music, I'm actually asleep for the 90% of that time. And so as adults, we just brought our own sort of concern sensibility to it. And it wasn't until we actually talked to young people that they were like, no. So I think those are two really critical aspects. Bringing young people in at the earliest points in the research, having them as parts of the process can make the work so much stronger. So thank you. Okay, next question. How would you respond to those who say we don't have time to wait for the research, that we just need to move forward now with making change?
You can't overstate, I can't overstate, I'll speak for myself, the importance of making sure that our policy is backed by research, especially in this age of mis and disinformation and devaluation of experts. And expertise. So I think that it's important because we want to make sure that the decisions that we're making for our youth and that our youth are making are backed by research. I also know that it takes a long time. Sometimes from conception to publication, it's at least 3 years for the research to get to the public, and that's really too long. And so I think that we can do more of what we're doing today, like having these conversations where everyone is contributing and we're sharing information, sharing knowledge across fields and across different perspectives. And so I think that's important, but I think we should do both. I think both are necessary, doing the groundwork in the community while also doing the research.
I agree. I know that's a shocker, but yeah, I think we need to do the now work and we need to do the long-term work. And I think that investing in programs like Young Voices, where you have, communities of youth who are ready and willing and excited to share their brilliant perspectives, I would love to see that everywhere. I mean, how amazing would that be? And I think sometimes the way that we think about sort of the threshold for change, it can be overwhelming when we're thinking about the years it takes to do research and get published or, comprehensive legislation. But the truth is there's really a lot of low-hanging fruit that, tech companies would like us to forget about. But there is no reason that when somebody reports the kind of behavior that we heard about today, that account shouldn't be locked down. We all know people whose accounts have been locked down for ridiculous reasons. And you're gonna tell me when we have the evidence and we have repeated reports that you can't protect the young people that are using your platform? That's poppycock, as my mom would say. And, I think that it's also important for us to check the hype that we hear from tech companies. On the one hand, we have all of this rhetoric around AI and the promise and capability of AI, but we know it's technically possible to create, say, features on an account, that you could have a training period. Maybe when your kid gets an account, you say, for this week, we're going to train the account to recognize the kind of content that we want them to see. Totally technically possible. You know, there's all kinds of things that could be done today if companies really wanted to put their money where their mouth is. They also need to invest in more research. They also need to open up their data and share access to researchers so that we can truly understand what's happening under the hood. So I don't even remember what the question was, but.
It's a good stopping spot.
Yeah, I think that we as scientists sometimes need to do a better job of like letting the public know that, you know, good science takes time. And the scientific process is very iterative, right? I mean, the whole point, you know, when we put our research out there, you know, is that we kind of expect that it's going to be maybe disproven or maybe validated or maybe adapted into different ways. Just kind of, you know, I guess being vulnerable for a second. I mean, well over a decade ago, I started looking at social media use and young adults. You know, and all we did really was we asked questions about the amount of time that you spend on social media and how many platforms you used, and then mental health outcomes. And we found an association, and we're like, oh, wow, you know, there's an association between social media use and depression. But that has now morphed into ways that, you know, other researchers have taken that and said, no, it's not necessarily just how much, but how you use it and, you know, your different characteristics, and it's very much based on nuance. So whereas we thought we're like, oh, we're onto something, it turned out that, you know, it took other researchers to really move that forward into a way where we have a more rich picture.
I want to build off of that, what you're saying. Do you think that researchers aren't necessarily, maybe we're not doing a good job of translating our research out into the world? Or is it that we don't have enough research yet that tells us the things we need to know? Is that, like, I guess, is it that we just aren't, that we as researchers aren't doing a good enough job? Or
What do you guys think?
is it that there's not good work? Or maybe both and?
I have things to say. Okay, how much time do we have? Gosh, darn, this has been
10 minutes.
the challenge of my career. So in a prior life, Amanda and I worked together at the Pew Research Center, the Internet and American Life Project, and for 13 years together. And, you know, so we have been through some research translation gymnastics. And what I can say is that, having been in this space for a while now, that it truly is incredibly challenging for researchers to not fall into a trap of extreme rhetoric and sort of pre-existing narratives that are known to sort of as dog whistles or you know, known to sort of get people to read the article, or and so you can be as careful as possible. You can have everything perfectly stated and translated, and you know, you can still have a headline slapped on the article that's misleading. And I've had to like counter this at the biggest, most respected publications. That said, I think you know, working with reporters or other researchers or communicators who, you know, you trust and you know are willing to take the time for the nuance, can produce incredibly powerful translation work. And I think that all of us in this space are just fundamentally dealing with the problem of attention, right? Like, whether we're communicating with parents, we're communicating with our kids, policymakers, right? Like, and so because of the ecosystem that we're living in, you know, we've resorted to these more extreme tactics to get people's attention. And I think oftentimes that can backfire, and we need to step back. We need to have more events like this where we're having real thoughtful conversations.
I'll just say really quickly, I think, at least from my perspective, academic institutions tend to place higher value on peer-reviewed journal publications and book deals, what have you. But I think maybe there needs to be more incentivizing of disseminating your research through media and other public outlets that reach parents, that reach youth. And I just don't see that enough. It also, that might look like providing the resources to be able to do that via training, via protected time. Also, maybe that could be included as a formal part of your review for academic promotion. So those are some ways to incentivize and provide the support that's needed to make sure that we can get the research out there. Because in addition to, I think, many researchers not knowing how to do that, not having the training to do that, a lot of times we don't have the time to do that. And just because of the nature of our work, and that's unfortunate, and I think kind of defeats the purpose of research in the first place, in my opinion.
Yeah, and I just want to add one last point, which is that I sort of dovetailing off of what both of you have said, the research is really nuanced. It's not that clear. And I think we're starting to get little pieces that are popping up and giving us a sense of where we're headed. But there's a lot of push in public communication about research to simplify, to make it clearer, to make it more accessible. We go through this every day in the work I do at Common Sense and the work I've done at Pew. And it's when you try to have a nuanced narrative, you're constantly getting driven towards one that is much more extreme, as you said, and much more simplistic. And I think that can be what leads to, I think, misunderstanding research, misapplying it, and can really, I think it's a real struggle for researchers to have their work be understood in that complex way. So,
can I add really quickly to something you said earlier, including youth and parents? I think in the research process early on is so important. I think that also could help solve this problem of us, not being able to get a lot of our research out to the public and communities quickly. If youth and parents are involved early on in the process, then they can also inform how we disseminate that research. And so I'll add that.
Great. Oh, all right. This is our last question. If you had all the money available from NIH and access to any researcher anywhere in the world, how would you go about studying this problem? What's your dream research?
Oh my gosh. Yeah, I mean, I think we've just been saying this over and over again. I mean, money to truly be able to do, community engaged research, right? Like, I'm lucky that my project was funded by the NIH. I have a youth collaborative that guides my research. They meet with me on a monthly basis and they tell me that I'm wrong. And I love that. And, and I hope to see more funding, especially federal funding, being put toward that type of research.
I would agree. I think community collaborative research is extremely important, and that would be an ideal project to work on. But I think also for me, being able to do a longitudinal study where I'm not only looking at the within and between person effects of the impact of specific areas of social media, but also looking at intervention and working with youth collaboratives and community collaboratives to think about what are the interventions that are really going to work for us and that are feasible, that will be most effective.
We should work together, Ashley. That sounds amazing.
I know. This is the beginning of
a beautiful friendship.
Yeah.
I would just to echo what Ashley said. I mean, obviously, like our dream is to have enough money to do longitudinal work with a large enough sample of young people that would allow us to follow them over time, allow us to skin interventions on certain social media platforms or apply them to mobile phones and see what happens when you change different conditions. I think there's lots of ways we could really increase the robustness of the work that we do, but it's expensive and time consuming, and that I think is what is the real challenge. And so that's why this is, of course, the blue sky. I don't know, Mary, do you have anything to add?
Yeah, I mean, this is the dream. I think I guess I would just add that a dream study would also leave the participants in a better place than when they started, right? And so having a large-scale intervention in schools with family and youth as partners, understanding a holistic view of the structural, social, economic inequalities that play into the differential impacts that youth experience. And I think ultimately coming away with integrated, programs in schools that are long-term, resources for them. I think we do a lot of sort of skimming off the top interventions. Like my boys and I have a joke like every day that it's time for like the social and emotional learning activity in high school or middle school. Like I'm sorry to say, it sounds good in theory, but it's not something that when you tack it on, for that age is particularly useful. But when it's integrated into the curriculum or it's a core class, you can have much different impacts.
I don't think we have time for questions, even though we do have a room chock full of other fabulous researchers, all of whom could have joined us on this panel, I know. So thank you all so much for joining us and for having a panel with researchers. Appreciate it. Thank you.
Well, thanks, everybody. We have a really exciting Phil Donahue-esque ending to a fabulous day. We have invited Dr. Nikayla Cook to come moderate a final full group interactive session. And remember, when Young Voices, you were up and we ran out of time and you had a lot more things to say, this is the time. And just now when you guys said there's more researchers in the room and you got something to say, this is the time. Nikayla Cook is the executive director of PCORI, the Patient-Centered Outcomes Research Institute. And PCORI is concerned with, and Nikayla is passionate about individual voices and collective voices, youth voices, to inform research agendas. That's what Nikayla is all about. That's what PCORI is all about. And in a lot of ways, that's what many of us felt today was all about. We heard so many times, we can't do this with a top-down approach. We have to listen to what's good, what's bad. We have to sort of be nuanced in our thinking and chart courses together. Nikayla is an adult cardiologist by training, and before taking over the directorship of PCORI, was in the senior leadership of the National Heart, Lung, and Blood Institute at NIH. We're really lucky to have her. Before I turn it over to Nikayla, I'm going to, Nikayla, Ron Aubert, and I met for a little while before this session started and collected some thoughts and themes from today. The number one theme is how cold the room is. But aside from that, here's what we thought. And feel free to challenge this, but this is just going to be sort of a platform for a Dr. Cook facilitated discussion. One of the things we heard from Young Voices is that social media is mediocre. No one comes home from school and says, I saw an awesome TikTok. Someone comes home from school and says, I had a great volleyball practice. Or, guess what my friends and I did at lunch, right? And so perhaps it's not prying something that people love away from them. People don't hate it, but what I heard was that it's fine. The other thing I heard is that this isn't just about us as teenagers. This is about us in our schools, us in our families, and that if teachers are looking at their phones between math problems and we're expected to do something different, come on. And if we have to pry our devices away from our parents and they're expecting us to behave differently, come on. It's another thing to think about as we develop interventions. The other thing I heard loud and clear from both the parent panel and the youth panel is that no one's naive here. Everyone's sort of fully aware that companies are trying to sell us stuff. And interventions have to take that into account. The last thing was something that was mentioned just here in the researcher panel around gaining knowledge and using that knowledge to plan programs and interventions. And the problem that once you study something, if you're studying the technology platforms proper, as soon as your study is over, the technology is different. Gosh, how do you plan interventions around that? So with those kind of considerations, I'm going to hand the mic over. You can feel free to stand at the podium, walk around, and take it over. Okay. This must. Oh. Yeah.
Great. Well, thank you for having me. What an engaging discussion has already happened, and I'm sorry I couldn't be with you all day, and thank you, Mike, for that very generous introduction. It seems like you've had a lot of insights from the day. We heard a few from Mike already. I'm really interested in hearing some of the perspectives that you may want to raise or add to what we've just heard. I was really impressed by the fact that you had the opportunity to hear from youth directly and to really hear their insights and perspectives. And you heard that at PCORI, how much we value the lived experiences, the insights, the voices from those that we're really trying to benefit in the research that we fund and in the efforts that we put together. But we also think that you really have to center research around engaging those individuals very early on in the process and really thinking about what's important to them, what matters to them, to help shape and design the research and the questions, as well as the fact that they help to make sure that the way the research is designed is actually going to be acceptable to those that are participating and help to disseminate the results on the end when you have them available. And that was a theme that came up in the last panel as well. So I was really excited to hear some of that. You know, and the way we think about some things at PCORI that could actually be relevant to the way you're thinking about some things here is that we're really interested in bringing all the different perspectives together and finding where the shared spaces are, as well as to understand really through the voices and lived experiences, perspectives that perhaps may not be our own, and to think about how we might explore those in a research agenda and the way we'd focus research questions. And it's really not about trying to just come to one single solution. It's about trying to elucidate the benefits as well as the harms of any intervention that you may be be studying in order to figure out what may work best for certain individuals or populations in their circumstances. And I think that's a lot similar to what you've been talking about here. So I just wanted to build a little bit on this and talk about the fact that I think the most effective research really emerges when we try to make sure that we're focusing on the issues that are most important to those that we're trying to benefit, and we bring them into the work, and we imagine the way the research is designed in a way that's really going to be the way that they can uptake it in their life and circumstances and share it with others that may be their peers. So these are the principles that I think were embodied in today's discussion. And so we're going to use that as a launching pad for what I hope will be a very invigorating discussion, because we want to be able to walk away with some takeaways in terms of what this session meant for all of you and what we can think about in terms of next steps. So I want to thank you for your participation already and ask you, just to reflect on all the perspectives you heard today, reflect a little bit on some of the themes that Mike raised. And I'd love to hear if any of you are thinking about what the most urgent priorities may be from either your perspective and where you sit, or by thinking about how we might really think about research even for youth, that we want to improve the health as we think about the digital spaces that they're engaged in. So let's think about urgent priorities first. Several were raised. Are there certain things that you think are top of mind or most important for us to focus on as we leave the discussions that came together today? Would anyone like to open it up and share a few perspectives? Great, thank you. Can we bring a microphone to the front? Do you mind mentioning your name, since I haven't had the benefit of meeting everyone today?
Sure. Peter Chung, Executive Director, Young Voices. And so the thing that just because of the previous panel and talking about young people and being engaged in research and so forth, and I want to highlight a different project that we're working on with another doctor, another psychologist, and the idea that I think from the community, when we involve young people in research, and I think one of the things that I've really appreciated about this process has been that they came to us not saying that our young people be the subject of the research, but they came to us and said, look, we're going to go and try our best to get your young people to be part of the research panel. And so we were able to city certify 10 young people who are now, going through this process of research and being part of but the idea also goes beyond just the research. It's about transferable skills that young people can then take on, right? And so in this process, we had three young students who then graduated and are now freshmen in college. A transferable skill, a certification that they can then take on and then fully utilize for their own development. And I think when we think of this from a programmatic standpoint, we have to think of a holistic approach, because that even though they're the outcomes of certain things that we have to look at and do, but I do think that that's a really critical component that sometimes is overlooked in terms of how we're going to carry out the work. And so I just wanted to just share that the idea that high school students are city certified to be research assistants on somebody's research. And I think that's a super cool opportunity.
I love that comment, and I'll just mention, one of the things we do a lot of education about at PCORI is that when we're engaging youth, others, et cetera, in research projects, that's different than being a participant in a research study, and that it's that engagement of people that really bring their experiences through the research design, conduct, et cetera, that are critical. And maybe one other thing is not everybody may have that certification, but one of the things we recognize is that people bring important voices, and you have to think of those voices as an expertise that's really offered for the way in which the research is conducted. So I really appreciate you raising that. It reminds me of a story I heard recently about a participant in a study who actually went on to get some additional certifications to actually become an engaged partner in research in the future, and really changed and shaped the direction of a research team where they were going after having participated, and then changing into a role of being part of the research team. So really impressive to hear that that's happening already. So I'm hearing a little bit of a priority around the engagement of youth in the study designs, this identification of study questions, et cetera, as something that we can really take away, and being able to support that more fully through organizations that fund research. Yes, in the back.
So for me, something that came up really big is the opportunity to have parents and young people kind of work together to develop maybe media literacy training. We've worked closely with the organization that I direct, work closely with Young Voices and other youth organizations doing intergenerational, work. And I would love to see us collaborate, and I would love to see somebody fund that. So my job here as an ED is to find money to do work. So if anybody's interested in funding work that is intergenerational, co-created by parents and students from that lens, because obviously the space that we create for young people should be created by young people. But when it comes to parents, right, when we're talking in that kind of work, peer-to-peer work to me is, so successful and effective. So I would love to see what that will look like in a research design, having parents and students work to create a curriculum for media literacy. I think that's something urgent for me as a parent to come back and try to address that gap in how we support our parents. And may I add a training that is multicultural in different languages, culturally responsive. So just not one box fix all, because we know that every parent's gonna need, or every household might need something different.
Media literacy trainings. I love that concept as well. And, I'm thinking about the fact that it will look different for different families, and there may be some core components, and then there may be the ability to tailor for families, cultures, circumstances, et cetera. One of the things that I think is really informative to me, having heard a little bit of the discussion and the debrief of the discussion, is that even literacy training may have the opportunity for things that are both thinking about the positives of media and social media, as well as where we may fall into pitfalls and harms. And so I'd really be interested in hearing a little bit from the Young Voices team in terms of the types of things you think would be beneficial from media literacy training. Did anyone want to comment? Great.
I think when it comes to media literacy, we have to realize what kids want and what parents want, and being able to collaborate on both things without one overshadowing the other. For example, a lot of legislations that us as Young Voices and Caroline and Elizabeth have went over, they talk a lot about appropriateness for specific ages, but it's who gets to decide what's appropriate for specific ages? Because I think a lot of specific states and even specific people, they might take advantage of that to shut down some communities that a lot of young people are a part of. What was mentioned before, a lot of queer spaces, that's where most young people go on. I feel some people might take advantage of that and might want to shut that down. Mm-hmm. So it's who gets to decide what's appropriate for specific ages?
Thank you for raising that, and I heard the importance of it being a collaborative activity, which I think you really brought voice to, and making sure that there is the opportunity to engage both parents and youth around what really makes sense in terms of thinking about these types of training opportunities. Other priorities, urgent priorities that came to the fore? In the front? And if I can remind you, if you don't mind saying your name, it just may help everyone to know who's speaking.
Yes. Hello, my name is Marco Lima. I'm an alum from Young Voices, but some of the prior work that I've done with Claire, who sadly can't be here today, is on misinformation and the threats of it, specifically for communities when we're talking about local issues such as the housing market. But I think it's really related to this as well. A lot of research isn't compiled, so I feel as parents or even as youth myself, while I'm looking at the data, I see conflicting things often. Even throughout our discussions today, we have some conflicting messaging coming out with there's benefits, but we're not talking about that. but there's harms, but there's also so many benefits. Like, so we're kind of going in a circle of like, we can't delete it because that's not gonna work, but how are we gonna use it to better our lives? And then likewise, like a lot of youth are just not trained, or even adults, in looking at when something is made by AI. And I think that's super important with these discussions because there's so much like scams are happening. I mean, PPSD was just hit with a huge scam in the whole district, and like a huge data leak that happened, and they're all adults. Likewise, on the housing market, I fell for a scam when doing a project for the lab that I was working on. So if that's someone that's like looking for the solution, imagine just your everyday person.
I think that also contributes to the construct of what kinds of things may be important in training opportunities, because understanding when there are kind of the ways to look at artificial intelligence, potential for scamming and that sort of thing being incorporated in the construct of training. But I think I also heard something else in what you were talking about, and it was around this idea that there are a lot of unknowns. And when we end up in a space where there are a lot of unknowns, you may end up in some benefits here, some harms here, unknown clarity, and really how do you weigh all that information? And you know, one of the things that I'll draw upon is something we've learned at PCORI is that often there's not just one answer, even to the type of research questions that we pursue. It's often about thinking about the trade-offs, the risks, the benefits, the harms and the benefits, and having ways to really talk through that and work through it. And so in this situation, you know, it may be about having that informed community around you to be able to talk it through, but I'd be curious about what other people think in a setting where there isn't a lot of known information. We don't have a lot of research results that are so solid that we can act on them. What do you suggest in terms of the way that we're discerning about the information that's out there related to social media youth and youth, social media use in youth? Love for you to answer. Do you want this one?
Yes. I'm going to be a little bit of a curmudgeon. You know, having been a toy maker all my life, I used to listen to my engineers, and we were 95% good. No, Alan, we can't go forward. We have to get 1 or 2 more percent. I listened today, first of all, to Young Voices, thank you. I try and get, and even in the election, I tried to get male, menopausal, older men to understand who the boots on the ground are and who to listen to. We should be listening, and they should be testifying in Congress. And if there's one thing I'd be giving money to, is trying to get Young Voices spread across the country. Because today, if it's one group, it's not going to work. I also would tell you, last night, Aaron was speaking, and he talked about studies, great studies that were done, scholarly studies, and yet they were put on the shelf. And then maybe 40 years later, someone said, oh my God, that was a great study. Stop studying the studies. And I'm serious, because once you continue to study the study, nothing gets done. And I would tell you on research, get more research from the young people. Even forget the teachers. Go to the young people. They're the boots on the ground. And move forward, collaborate. But again, some of the things I heard today from some of the speakers, it's the same old, same old. It's academia in silos. Go out on a limb. You've done enough research. You know there is a problem. We got involved because the Surgeon General came out with the report that 50% of teenage girls in America have contemplated suicide. Is it true? I can't vouch those numbers, but if it's true, then if we don't move and move together quickly, we will have blood on our hands. So it's about time we all buried the hatchet and figured out the most important thing for me today in being part of helping to convene this is to move forward, not to basically tread water any longer. Forgive me.
I don't know what I'm forgiving, because I wouldn't call that curmudgeon at all. I'd call that a call to action, and want to hear some other thoughts about how we move forward.
So, this is on. Mary Madden again. I absolutely agree that we need to have action and we need to put youth voices at the center. I think that something I would offer in terms of sort of investments that I've seen work extremely well. From my work with the Joan Gans Cooney Center at Sesame Workshop, I was working on a large-scale project with the public media ecosystem and supporting and amplifying youth voice through various programs across the country. And what I can say is that when you have an opportunity that is structured to help train young people to communicate their views, to make media, to learn about the process of pitching, of editing, of presenting their ideas, of dealing with publication, and you integrate that starting at the middle school level, it is absolutely transformative. And I've seen it with my own boys who have gone through a program in Arlington County Schools. I think you absolutely have to have more education that treats the responsibility of media making and using these powerful tools more like getting a driver's license. We don't put kids in a car on the road without some experience and some training. And the fact that we're trying to just sort of add on these, one-off interventions and expecting young people to sort of internalize that, but not really baking it into how they learn how to communicate visually with, text and audio. And I think there's an opportunity there to invest more heavily in programs like that.
I wanted to just amplify something I'm hearing from you, which is a much more kind of system level approach in terms of thinking about how we move forward in an action-oriented way. And I think this is actually something that can be an incredibly useful takeaway for us, because I think all of us can have a role to play in bringing together these types of system level approaches. I'd love to take that further. I think I saw another hand raised with someone that wanted to contribute along those lines. Did I overhear? Oh, I'm sorry, on this side. Thanks.
Hey, my name is Eric. I'm the development director here at Young Voices. Actually, we do have an open LOI with PCORI, so we're very optimistic and hopeful that we'll be able to work with you in more of a dedicated capacity in the near future. I think, we've identified, many times, like the need for, collaboration with parents, with youth populations in doing the work. And I think everybody here agrees with that and knows that in the abstract. But oftentimes, I think when it comes down to actually doing the work, lo and behold, we find that a lot of times, the people who are working to drive that policy, whether they be policymakers or researchers themselves, oftentimes do not meet those client populations where they're at, right? And with the knowledge that, young people cannot make the 12 p.m. Zoom call, because they are at school. Or that, parents, right, can't come immediately to, your afternoon meeting at 3 p.m. because they are working, right? And anybody can develop a policy, a school can develop a policy and push it through, and say it's like with the input or collaboration of young people or client populations, but then ultimately, are they really being true to that, right? And so I think kind of in doing this work, there also has to be kind of an acknowledgement, right? That if we're truly to commit to the idea of involving young people, involving parents in determining policy, that we have to, you know, we have to meet the client populations where they're at. And I think that's just been one just exemplary piece of Dr. Caroline Kiston and Elizabeth and the work that they've been doing, that they've been so willing to meet our youth where they're at and to really kind of entertain their input over these past few months. So we're really thankful to have a group of people in the room who understand that and commit to that in thought and in deed. So.
I love that comment. Thank you for sharing it. And we have another one in the front here. Okay.
Real quick. I'll get to everyone. Just let me switch this mic.
Do you want to use this one in the interim?
Yeah.
Yeah. I appreciate Alan's call to arms. I also appreciate some of the researchy capital R perspectives too. And I mention that with a very specific perspective is that one thing I'm concerned about is that given that each teenager, each family consumes social media differently. And we've heard eloquently over and over today the benefits and the harms. If we pursue a sledgehammer approach, and I know no one was advocating for a sledgehammer approach, it's very different from a call to action, that there is very likely to be a benefit-harm balance. That there's a benefit-harm balance with everything. But I think it's particularly acute in this one. I think we heard if you take away our phones, blanket, at the beginning of school, one, we'll find a way to break the boxes to find our phones. And two, we're going to feel disempowered and disenfranchised, and that's not going to be good for us. And so I think that was just sort of an example about an intervention style or an intervention strategy that is likely to have benefits. Maybe someone will pay more attention in math, but at what cost? And I think this kind of field is kind of really right for, I think, Nikayla, what you mentioned is a really thoughtful weighing of harms and benefits.
Mike, where you and I would disagree on this, and again, it was young voices, not teachers talking about this. I heard them clearly say, we are watching cutbacks in state governments. They're taking away sports, they're taking away after-school programs, they're taking away teachers, they're taking away counseling. If you can't get together on at least talking about those takeaways, then every day they're going to have more and more. So I'm saying my call to action is basically to get together, figure some of the pieces you can work on, and move them forward and get the dialogue going with the different people we're going to have to go up against. This is not a scorched field by any stretch, but we know, especially with the past elections, that all of us are going to be hurting for federal dollars and state dollars. So all I'm saying is there are certain areas that we can be helpful in right away. We can be helpful in getting more money if we can have a program by Young Voices that talks about going state to state. We can definitely begin to fight some of the cutbacks in state levels. I mean, I already know what's getting cut back in Rhode Island. and it's everything they say. But there are people like us that are willing to stand up for what's right for our next generation.
Great. I think I'm hearing a little bit of the both and, meaning that there are some areas that perhaps we already have opportunity to make concerted efforts, and other areas where we still need a real understanding of the benefits and harms in a research approach.
Yeah, so I am so thrilled that everyone today has gotten to meet the folks from Young Voices. I have had the great pleasure of working with them for 6 months, and I'm sure you can see why that has been just such a highlight for me. I wanted to specifically name a couple components of that work that made it possible for folks that are interested in doing the same thing. So one of them was that we paid these kids. Like, we are working with them as colleagues. I get paid to spend time with them, and they get paid to spend time with me. And that's a really important piece of the work. We also had the benefit of going in without an agenda, aside from to set an agenda together and to start by sharing information back and forth. And so the only thing that was like a set thing was that I was gonna bring chocolate-covered pretzels every week. Other than that, we explored every possible snack from the Trader Joe's that's down the street. But we came to this together. So, you know, I shared some of what was on my mind. I brought to them the report from the National Academies that was really resonating with me, and asked them to read it. That's how we started, and to let me know what they were surprised by. And I have to say, with that report, what I heard from them, this was our very first interaction, was that they had never seen written down in an academic report that social media can be fun. And so thank you to the National Academies for helping us set the stage to not have a, like, is this bad or terrible kind of conversation. But we were able to do that because we were not funded by the NIH, where we would have had to, before starting the work, have an agenda with specific aims and a timeline. We were funded by the Hassenfeld family, which gave us the funds that we needed to work together. We have so many, these kids have a lot to say about what the folks at Trader Joe's think when they see me coming. We have possibly eaten all the chocolate pretzels, I think, at this point. But that type of funding is very different, and that approach is very unusual in our usual funding structures. And there's a real need for that type of funding so that we can go in and build from the ground up for work that I hope does lead to more traditional funding, because I think both are needed. But that doesn't happen by asking these folks who are quite busy to volunteer their time, especially in a room where I am not volunteering my time. And so just wanted to make that pretty explicit for folks that are hoping to do similar work.
So much for raising that. And I just want to give you 2 quick resources if you don't know about them. One is that PCORI actually offers engagement award funding, which is about convening in order to identify the research agenda with your research partners that will likely not come from a traditional research background. The second is that we have a resource called Foundational Expectations for Partnerships in Research that outlines the things that help to make these partnerships successful, including compensation. And it's one of the key principles within the Foundational Expectations. I think it's useful even if it's not a research project, even if you're thinking about how to engage with systems or programs, to look at something like this to think about how you engage youth in that setting. So just wanted to raise that. I saw multiple hands over here. Do you mind introducing yourself?
Hello, everyone. My name is Andrea Gonzalez Sanchez. I am the program manager at Young Voices. And I've been working with young people for a very long time. And I know that today we're talking a lot about this big funding and all of these like research projects. And I know that some of you might not be researchers, and some of you might not be people who are in charge of funding, but some of you are parents, some of you are people who just engage and care about young people in any kind of way, educators, people who also just are like, these people are the future, I want to support. So to all of you who might feel like some of these things don't apply to you, I want to empower you and encourage you to remember that all of these changes have to start to some extent with us. When we are talking to young people and we're listening to them, actually listen. And when you are listening, actually trust. Trust that they're being honest. Trust in their intentions. I know that there's so much fear and we're all like, we need to protect, protect, protect. But young people are here and they're telling us what they need. So believe in them, trust them, give them that support, and let them know that you know they're doing their best and that they're trying to make the best decisions. Because when we just make those decisions for them, when we tell them, I can trust that you're gonna tell me the truth, I'm just gonna track you, or I'm just going to like see what you're doing online all the time, they're kind of smarter than us, so they're just gonna hide it better. Like, that's the reality of the thing. So we need to try and build that trust with them from the get-go. And when they're telling you things, empower them, encourage them, question, and kind of push them forward, because we are the ones who start building that confidence in them, but we're also the ones that can knock it down in an instant. A lot of youth have been silenced by their parents, even though they had the best intentions, by teachers, by educators, by random strangers on the street who always think you're too young to know. So it starts with us. We need to believe in our young people, and we need to make sure that we remind them of that and that we truly trust their decision making and we listen.
I love that. Thank you. There are 4 people in queue, so I'll come right back to you. I think there's someone over here, back here first. Okay. Yes, thank you.
Ms. Maria. Okay. Hi, my name is Maria. I'm the co-chair at the board of directors at Young Voices, and something that I wanted to add on for both points was that, like, during our meetings, as someone who loved the pretzels, it felt like this like strong conversation that we were having. You know, it was like a give and take kind of thing. Like, we were going back and forth and talking. So it felt like we were actually being listened to. And then like we would get like a response back, and it was going back and forth, which is why I think it went the way it went. Why I think it went the way it did, which went pretty successful. And also going on with like what Andrea was saying was just like basically just listening to the youth, because we do have a lot to say. And it's not just because we're too young that, oh, we can't say things and have them make sense. Like, we do have proper input because, you know, we're still in school and we're experiencing all these new things. And like, we're in the heart of social media and everything like that. So we're like basically the first generation experiencing that, so.
Thank you. All right, I'm going to ask if the other comments can be brief so we can get to all of them. I hear that there's one in the back here. Oh, yes, here. Two in the back. Okay. Great.
Oh, me first? Okay. I'll just really briefly, I just wanted to, I'm Jen Lillis, and I just wanted to bring the schools back into this conversation around urgency. And just, you know, so much of what we talked about today is like the policies that are coming into schools now. And I guess I've just been thinking a lot from the conversations today about how we can make sure that youth and parent and educator voices are all coming together to inform the policies that are happening in schools. So I think that there are some really great opportunities to take some of the ideas that are coming out here and maybe have like youth recommendations for school policies, youth recommendations for media literacy, you know, some toolkits that schools that are just getting going on this can have a starting point that is informed by their constituents.
Thank you. Okay, and in the back, will you introduce yourself?
Yeah, Jocelyn Antonio. I work for the Hassenfeld Institute. There's 2 things that came to mind during this conference. The first one is I was at another conference around school wellness a couple weeks ago for Rhode Island, and one of the districts has implemented the pouches that you all mentioned, and nobody was pushing back against the benefit of those pouches, and rather it was being shown as like a success and unity around the school leaders. But then, you know, hearing what Youth Voices says, it's like so different. There's like such a dissonance between what leadership at schools are doing and what youth are experiencing. So that's like one thing that I think came to mind, how we need to like bring voices together, like you mentioned before, because there's just a huge dissonance, I think, between what is going on in the ground and what youth are experiencing right now. And my second thought was, like, our policies are not moving fast enough to catch up to what is happening with technology, and we've heard that over and over again. So my biggest concern now is like not just the youth, but younger children. What are we doing for preschoolers, for elementary school students? Like, how are we going to address that when we can't even do that for older children, like high school students? So we need to it feels like we're already really, really behind, because there are kids that have been born with the knowledge, growing up with technology to a degree that us adults might not. And so it just feels like we are not moving fast enough to address this situation.
Thank you. I think we've heard that too. We're going to go here and then back to you, Alan, and then I think that may be all we have for the comments given time, and we'll wrap up.
Just really quick. My name's Bernita.
Thanks, Bernita.
So one is always remember to scope the room when you're designing, and make sure you find out who's in the space and who's missing. And if someone's missing, make sure you invite them in as a active participant, or equally active participant, right? Not just to hear from them, but to be a co-creator. The second thing is, what other opportunities expand from this experience for our youth? Generally, we ask youth to come in, or parents to come in, and then kind of send them back to their prospective corners after we've talked about a subject, right? But what lies ahead for these young people when it comes down to scholarships or internships, where they transition from being these youth leaders to working at some of these very organizations that are here, right? You already have youth identified. So I challenge everybody in here to find one of these youth and say, hey, I have an internship, or I know about an internship, and I'm willing to write a letter for you, or I'm willing to invite you in, so that they gain more experience in this field. The last thing I'll say is that define what experts are. I keep hearing people say experts, and then they say parents, or experts then youth. Lived experience qualifies a person as an expert.
Thank you. Thank you. Wonderful comments. And Alan, I think it's appropriate that you give us the last comment.
Oh, thank you.
Okay.
And then I have one question to ask of Young Voices, and really Caroline.
I just wanted to say something that I heard over and over, and just point out that I think it's really important for you guys in the research community, at least from my perspective as a parent of teenagers, to try to, and this goes back to what I asked originally, help to define or not define the difference between what qualifies as social media. So whether you're going to broaden it or make it narrow, there's so much of the counter argument for limitations lives behind, well, but this doesn't qualify as social media. It's just technology. So I think that would be really helpful. But also, I think it's one of the things that I heard so much of is that I don't feel like is, and this leads to the nuance point that you all brought up, and I think it's so important, is that so much of what is happening on social media platforms, from everything that we've heard today, feels like it's an amplifier for already existing problems, already existing mental health issues, already existing structural inequities, things that were there. And I think it's so important to talk about also not just the content loops, but how the algorithms create these loops that make that so much worse, these already existing issues, and without answer, because the resources are gone on the backside. I think it's important to hear that more. I don't feel like I hear that as much in the general press.
Thanks, Susan. I grew up believing, I'm going to get killed on this one, so everyone be quiet, that there were males and there were females. My question to Young Voices is, why were there no males on the panel? And can I go to the parents? There were no males on the panel. I think it's important that we understand a little bit better the lack of participation of the lesser of the two genders. That's the males, by the way. No, but I'm very serious, because I know we talked a little bit about this, about timing, but we've got to get both males and females involved, or we're in trouble.
I pulled one of the male panelists to do his own session.
Rock, paper, scissors.
Well, one of
I will say, so in my experience, right, and I think we go through different waves of like engagement and participation. So when it was, 10, 12, 14 years ago, I was in program, when I was doing programming at Young Voices, predominantly male. And I think over the years, what we've seen is that we've seen this fluctuation up and down, this roller coaster. And I will say over the last 5 to 7 years, we've seen an increase in, or the increased gap in participation. So I think if we look at our data set right now, we would be looking at 60-40, 70-30 at best. And I think one of the things that I've heard from young men who have come through our programs and is really talking about like what does engagement look like and where does their interest lies. And then what does accessibility looks like for a student athlete? And I think like that's where a majority of our young people, particularly boys, engage in. And they're saying, you have this great program, 3:30 to 5:30, 4 to 6. We're in practice 4 days a week. And by the time we're done with practice, there's no program, right? And so there is a need, certainly, to engage young men, particularly young men of color. And I think that's, we're always trying to drive that. Also, I will say from a recruitment standpoint, and when and I'm sure that our young people can affirm this, like, they don't want to see adults in a cafeteria for 23 minutes where they can only eat their lunch. And so trying to talk to young people, they don't want to see an adult. And so when you go from a peer-to-peer recruitment strategy, people bring friend groups and so forth. And so, people come in pockets. And so for majority, if you're having predominantly a, female subset of participants, like that also then translate. I will say,
it will be hard to get funding unless you're faced.
yes. But I will say, I will end off by saying this. We have a lot of participants in our program right now. This just happened to be the cohort of students who raised their hand and said, I want to be on that project. And I think giving that autonomy to young people and meeting them where they're at, I think has been critical for us. But yes, you are correct. Funding should be balanced in that way.
we have
As-
two more comments, and then I
as-
think we have to wrap up.
As far as the parents go, when we were doing our focus groups with Jenny, we were very intentional about including fathers in our focus groups. We intentionally reached out to them, and about 25% of our participants were fathers. So we knew how important those voices were.
Thank you.
I think a simple question, not simple question, a simple answer. Oh, I should stand. Okay, for anyone who didn't know, my name is Simisol, and this is my 3rd year at Young Voices. And honestly, I think a simple answer to that question is, are you giving the opportunity for men to even want to join this? Because it's like, when we think about advocacy, we think about like a certain thing, and it's like, do we want men to join? Like, are we giving them that space to join? Because there's already a lot of like social norms that like, it's like, sorry, but like we already have that like specific social norm that like men, like, they should already be strong and, like, they shouldn't be doing all of this. So it's like, we need to reiterate that and give them that space. If we do want, like, a more equal, like, and as you can see, like, we have mostly women. So it's like, did we give them that opportunity, like, to even come and join? I think that's an answer. Did I answer that?
Thank you. Unfortunately, we're going to have to wrap up this part of the discussion, and I just want to thank you because this was amazing. Thank you for bringing your true selves to this, as well as being willing to be a little vulnerable and voice, as well as identify what I think are several priorities that we can take away. So I'm going to turn it back to you, Mike.
Michaela, thank you so much. We really appreciate your facilitation, your leadership, your reflections. We can't thank you enough. Caroline, I'll turn it over to you for some quick closing remarks. And I know people have to get to the airport and things like that. So I'll just...
I just wanted to say a few words of thanks. So specific thank yous to Elizabeth Burke-Bryant and Mike Silverstein, who were really helping to design the program today with me, to Megan McGrath and to Maggie and to everybody on the Brown team, and to Jenny Radeski, who has been a real thought partner along with the American Academy of Pediatrics Center of Excellence. Jenny and I have worked together for years and years, and it's just one of my great professional pleasures to get to do things with you over and over again. But it has been so wonderful for me to see all of you in a room together, to get to meet a lot of people in person whose work I've been reading and who I've been seeing in articles, in newspapers, and things like that. And what has really helped me feel like this was a good day was to see so many of you talking to each other and so many conversations happening between folks who, I think some of you have worked together before, but folks, I saw a lot of connection between folks who I know have not met each other before. And so our hope, again, is that this is the beginning of some connections with folks that you maybe haven't worked with. I want to show people we do have a QR code here that goes to a website for the conference. It will have some more information on the speakers who you heard today. We also videotaped each of the sessions, and it's going to take us a few days, but those sessions will be up and available on the website probably early next week. And we encourage you to check them out. We know that folks sometimes had to be in and out if there's anything you missed. But share them with your organizations too. We would like to, we know that the room was small and not everybody who wanted to be here could, and please feel free to share that content if it's helpful. There will be photographs up as well that you're welcome to see. And so I just wanted to invite Jenny to say a few other words.
Thanks. I wanted to wrap up by saying I have been to so many convenings about social media and youth mental health, a lot in the past couple of years. It's a big topic. This is the first one where it really felt like community was here, where it was people sharing their grievances, their burnout, and their joys and their hopes. And that, number one, I'm a policy geek, right? I work a lot with the AAP on policy stuff. I really hypothesize that the balance of those joys and all that burnout could be a lot better if we had tech regulation and we had policy that made these products designed in a way that wasn't exploiting people's attention and time. But until we have that world that I wish we were living in, this is such an awesome ground for connection and building of community resilience, because there's a lot of power in that. So I hope that that is where this goes next, is really kind of figuring out how do our communities build the digital literacy we've talked about, the community-based decision-making about like, this is the right time for this is not the right time for that, helping share our knowledge as we tried to do in the report. And then I love just the evening of the power differential between academia and community that is really apparent here. And isn't apparent in a lot of spaces. So congratulations to the Hassenfeld Child Health Innovation Institute, because you really make that happen.